Howdy, folks, and welcome back to another episode of Healthy Humor. I'm your host, Doc MB, and with me today is Dr. Tristen Swengle. She is a board-certified physical therapist, and we're going to be talking about pelvic health today.
I'm so excited.
Yeah. So you work here at Vitality Health.
Yes.
This is the pelvic health side of the business. Mm-hmm. So what is pelvic health?
Yes. So pelvic health can be so many things. So we do have both sides. We've got the Vitality Therapy and Performance side and then the Vitality Pelvic Health side. And so just pelvic health in general is in the realm of physical therapy, but it's just more specialized in terms of where we're going to really, I would say, start our focus is going to be the musculoskeletal, system of the pelvis. So everything that attaches to the pelvis, how it interacts with the pelvis. But if you think about how our whole body works, it works together as a whole unit, not just as a body part.
Right.
So even though we're kind of starting there to see its relationship and what's going on, we're implementing really the full body in what we're doing with physical therapy.
Right.
So anything that's bowel, bladder, or sexual dysfunction, if that's where our concern is, then that typically tends to root in the pelvis. But a lot of other areas based on compensation and things like that can be involved too. So we want to look at that as well.
How often are people coming to you and they just think they have something that is causing, that is related to pelvic health, some sort of dysfunction? And how often is it that a provider has told them?
I would say probably 50-50.
Okay.
And so I feel like we're definitely in a season where I'll say men and women, because pelvic health is not just to women, it's for everyone. But a lot of people are really learning how to advocate for themselves in the health and wellness space.
Yeah.
And so because of just the way that our insurance system works and kind of healthcare is for the most part, there's such limited time available to speak with your provider. And so if you feel rushed, then especially something so intimate, it might be uncomfortable to discuss hey, I'm having pain with intercourse, or I'm experiencing leakage. So people don't tend to always bring it up, or they feel like if they do, they're just going to be written off of oh, well, you're this age, or you've had this many babies, or they kind of normalize it to where oh, well, maybe this isn't something I should pursue. But that's not every provider. And so there's so many providers out there who are that's something that can be addressed. I'm not the provider for that because it takes a lot of time and everything. And so if you're coming in for a surgery, that's a great time to see your OBGYN, your surgeon. But if they're this can be addressed with activity and exercise and individualized care, that's something that's going to take more time and needs to be with a physical therapist.
Right.
But other people are doing their research, looking into what could be beneficial, and then reaching out saying I saw this. I saw a reel on TikTok or Instagram or whatever on TikTok. So that's also just been really cool for people to get to learn and it start to be more normal in that this isn't so taboo to talk about because pelvic health has been so taboo.
Oh, yeah. Yeah. And there's also the old adage of well, it happened to my mom. Or
100%.
They had this issue, so I'm expecting that I'll have this same issue after pregnancy.
Yes.
And it's well, you don't have to pee a little every time you sneeze.
Correct.
Or get on a trampoline.
And pelvic floor dysfunction is not genetic. So there might be some things you think about uterine cancer, prostate cancer. Those markers can be more geared towards genetics, but when it comes to urination or pain with intercourse or something along those lines, you're not genetically predisposed to experience those things just because your mom, aunt, cousin all experience them.
Right. And it's not just because, obviously men have a pelvic floor as well.
Correct.
But so it's not just females, but it's also not just females who have given birth.
Correct.
It's not just individuals who have, carried a child or done those things or have had some sort of potential trauma. You could be a normal average everyday person, right?
Exactly. Because you use your pelvic floor every single day. So the three main functions are going to be bowel, bladder, anything to do with either one of those. And then of course, sexual function. So that's the main things that we think about. But then your pelvic floor also acts as a sump pump system. So by it relaxing, contracting, and lengthening throughout the day, it helps shunt blood from your heart down through your legs and then back up. So think about women during pregnancy, lots of lower extremity swelling. There's a lot of pressure from baby fluids, placenta, all of that. And so it's compressing on those vessels. So then they swell because they don't circulate as well.
Okay.
And it's because of the pressure on the pelvic floor, which, yes, is also due to the weight of baby and fluid and all of that.
Right.
So that's part of it. And then also stability. So like this is where your hips attach. They attach to your pelvis. Your spine attaches to your pelvis. So this is your center.
Yeah.
Like that's what pelvis translates to, is stability. So it's not just I pee on myself, I am constipated, or I can't poop, or I poop on myself, or I have issues with intimacy.
Yeah.
Like there's so many things that can stem from the pelvic floor. And even it's a really common referral, like pelvic floor dysfunction can refer to your hips and it can refer to your back. Yeah. So some unresolved back or hip issues can be residing in the pelvic floor. Yeah. But if it doesn't present like that, then we might never go that direction.
Right. And that's, I think, one of the things that I really enjoy about this kind of pelvic health movement that's going on.
Yes.
Is it goes hand in hand with, we're a whole person.
Yes.
We're not just, we're pelvic health, or just low back pain, or just, someone who's had heart disease, anything like that. We are a whole person, and different things will affect each body part differently. And then, like you said, they can refer or transfer and influence other parts of our body.
Yes.
And I'm glad that people are starting to kind of look at the whole picture for themselves.
Yes. And not just hyper-focusing on one small area.
Right.
And even how dysfunction creates compensation. And I think it's beautiful how our bodies have been created and that we can compensate for this area isn't working very well, so this area can take over. However, like compensation shouldn't be long-term. And so if we think about how long most men and women are dealing with dysfunction because it's embarrassing or taboo to talk about, the longer those compensations take. And then if we're having to untrain certain compensatory patterns you've developed over potentially years, like that's going to take time. So the sooner you start to recognize something and you get it addressed, like the easier it will take to fix. Right. Because you're not going to be like, oh, okay, so this has been going on for 6 years. You now have like this. We have to start addressing. There's so many complexities to it, not just if we pee on ourselves, we assume I just have a weak pelvic floor. And it's unfortunately, typically that's not usually the only case, and it's typically not the case across the board.
Yeah. What is probably, because obviously, there's the stereotype of, oh, you pee or have issues with incontinence or something like that, or sexual dysfunction. But what are some signs that someone may not recognize that could be a symptom of poor pelvic health?
Yes. So, I mean, you think about, if you talk about urinary specifically, you can think about frequency and urgency. So how often am I using the bathroom? There's normal bladder habits, which are that you should be emptying every 2 to 3 hours if you are consistently sipping on fluid throughout the day. And you should, when you empty a full bladder, it should be about a 7 to 8 second stream, and it should be a strong stream. So not a piddle, not just a like shooting out and then it ends. That's a good indicator of when I went to empty, based on the signals I was getting from my bladder, it was full. But a lot of times we're going much more often than that. We don't really let that signal tell us like, hey, my bladder's filling, but I'm not full. And then going back to whatever we were doing. So I would say frequency is a big one. And I also think it's very inconvenient. I mean, think about when you're working and you get into your flow. If you're in your flow, you don't want that disrupted. It takes a little bit to get into it. And then once you're into it and it's like 30 minutes later, you're like, great, I have to stop just to use the bathroom. Like it's an inconvenience. But then not only during the day, if we're going so often during the day and our bladder, which is a really habitual smooth muscle, has gotten accustomed to that, then when it comes to evening time, we might be waking up at nighttime. And that's the only time I tell people that they have, I don't want to say permission, but then I'm like, I'm okay with you waking up in the middle of the night to empty your bladder, is whenever they're pregnant. And like you have so much, you have weight of baby, placenta, fluid, your bladder, which is smooth muscle, is not able to stretch like it typically would because there's other things in that area that are preventing that from happening. So your ability for full bladder capacity is impacted. It is possible you will have to go. That doesn't happen across the board, but it can. And even if it comes to like, I'm waking up in the middle of the night with my kiddo, that's fine too. Like if you're going to empty because you're like, I don't know when they're going to wake up again, I don't necessarily encourage it. I'm not like I'm encouraging you to go to the bathroom, but if it's going to be the difference between getting to care for your baby and not worry about like fiddling as you're over there trying to nurse them or get them back to sleep, I mean, you're already awake. But especially kind of when you're in your, 20s, your 30s, your 40s, waking up in the middle of the night might not seem like that big of a deal. But as women, especially, are getting into their like 60s, 70s, 80s, I mean, statistically, we have less muscle mass. Our bone density has decreased. So we might be dealing with things like osteoporosis.
Right.
And then you think of other balance things like our vestibular system and our vision that are impacted as we age.
Right.
And our somatosensory, so just our ability to balance ourselves. Right. These systems are all maybe impacted more so than they were when we were younger. So our risk of falling has now increased significantly. And when you wake up in the middle of the night, it's usually dark. You don't have all these lights on so you can see where you're going. Yeah. So for a woman waking up multiple times a night, she's increasing her risk of falling. And if she's already lost muscle mass and she has already like lost bone density.
Right.
And she's dealing with pelvic floor dysfunction, which has likely prevented her from doing a lot of like physical activity because it causes dysfunction.
Right.
Then her chance of falling and breaking a hip increases significantly. Mm-hmm. And then because of the loss of muscle mass that's occurred over the years from disuse, it might not be that she's appropriate for a surgery. So now she's bound up in bed. Mm-hmm. And it's actually one of the leading causes of female mortality is waking up in the middle of the night to use the bathroom and falling and breaking your hip.
I didn't know that it was
Isn't that wild?
Yeah. And what's crazy to me is as you were saying this, I was just thinking about not all of the cases, because we just talked about one.
Right.
But the overwhelming majority of falls that I've heard of in females, either related to me or, a family member, a friend or something like that, it was, they got up in the middle of the night to go pee and they fell.
And that's what happens. And so many detrimental things happen at that time, right? If it's not your hip, then it could be another area of your body. It could be your shoulder. Mm-hmm. And
your head.
Yes, exactly. Like so many horrible things can happen in the middle of the night just because you didn't have good bladder control. Mm-hmm. And so it woke you up. Right. And then not even like to set all of that aside, thinking of how that's going to impact you during the day.
Right.
If you can't get into certain restorative sleep patterns and like, because once a night is disrupting enough, but oftentimes we're hearing people who are waking up 2, 3, 4 times a night.
Yeah.
Like that's disrupting your sleep significantly.
Absolutely.
So then how is that impacting you during the day?
Right. Well, and if you're someone who's still of a working age or you just are still working.
Exactly.
You can't function the same way. Or if you're not, just the way that can affect you cognitively for other things, You
think about driving. Oh, you're exhausted and you're supposed to be driving and like operating heavy machinery.
Right.
Like that's terrifying.
Exactly. Or cooking.
Yeah.
And you forget and you grab something that's hot. Or something,
Leave the gas on.
Yeah.
Like so many bad things that like sound crazy that you wouldn't correlate pelvic floor dysfunction to like not remembering to turn off the oven or barely turning it off so your gas is still going. Like it's wild. Mm-hmm. But all of these things, it just goes back to how interconnected the body is.
Yeah. So obviously you were already a physical therapist.
Yeah.
What got you into pelvic health specifically?
Yes.
Because, it is very important. And I know that there's this kind of big push recently to get into pelvic health.
Yeah.
But I kind of feel like Vitality was a little bit ahead of that push. In the Tulsa area anyway, I felt like you were...
Yeah. The cash-based part, for sure.
Yes.
So I would say pelvic health in general for physical therapy has been going on for more than 20 years, which is great. And my mentor had been doing it for a solid 5 to 7 years, maybe longer. I hope I'm not wrong about that, before me.
Okay.
And so it was definitely being offered, but because of the tabooness around it, it still wasn't fully understood. And even by providers, it was kind of like, what are you doing? I don't get that. So, but the way we were the first, to my knowledge, cash-based.
Okay.
And we can get into that too, kind of why we went there.
Right.
But what got me into it specifically was, ironically, pelvic health was the last thing I wanted to do. Mm-hmm. It was more referred to when I was in PT school as women's health.
Okay.
So it hadn't really gone to that movement of this doesn't just apply to women. Mm-hmm. And so when I was going into PT school, I wanted to do pediatrics.
Okay.
I thought I wanted to work with kids. That was just kind of the direction I was going in. I soon realized that was not where I was called to be. I'm very thankful for pediatric therapists in general. It is not my niche. But pelvic health was my thought process was, it's just pregnant women. Uh-huh. I don't really think I want to work with pregnant women all the time. Seems like a lot.
Yeah.
And then my second year at PT school, one of our professors where I went to school at University of Arkansas was a women's certified specialist.
Okay.
So it's a board certification that you can take through the American Physical Therapy Association. And so she was just doing like a symposium, basically, which is mostly how pelvic health is introduced in most PT programs, at least when I was still in school.
It wasn't.
It's not like a
like
whole course.
Okay.
Like it's going to be just a little lecture inside of like a more overarching topic.
Okay.
So like here's pelvic health, and now we're going to move on.
Right.
So, 2 to 3 hour lecture.
Gotcha.
And so as I'm sitting there and listening, we're talking about, usually like urinary symptoms are kind of the first and foremost, how vast and like the demographic that this is affecting. And this is a huge quality of life issue.
Right.
If you're leaking in any capacity, it might stop you from doing physical activity because you don't want to leak when you do it.
Exactly.
It's embarrassing. If you know you're going to leak, you might not be very motivated to go out and do things because like, am I going to pee? Am I going to have enough like provisions to be able to address it? Anything like that. And so people get like stop doing certain things. So it like takes you out of, it's severely impacting your quality of life. Now we're kind of holed up at home. And same with anything with bowels. Like it's uncomfortable. If you're leaking stool, that's not fun, or gas. Like you don't want to be doing that in public. But if you're constipated, you're uncomfortable. Yeah. Like, so you don't really want to be out doing fun things. Like that doesn't sound like a good time.
Oh, yeah.
But the big thing that really triggered my interest in it was the pain with intercourse, because that was something that I had personally been dealing with ever since I'd gotten married. And I just assumed like, I guess this is how it is. Like this kind of sucks, but like, all right, this is the card we've been dealt. And so she's talking about like, oh, pain with intercourse is a really common one. I mean, like my ears were just like on high alert. And so I was like, okay, the leakage, big deal. The bowel, big deal. The pain with intercourse, big deal. Because you might walk around and you don't need a pad or you don't need to go to the bathroom all the time, but it's impacting the relationship that you have with your partner.
Right. And something that should feel good.
Yeah. Like it was created to be like enjoyable and pleasurable and like to make babies. Like it was created for a lot of great reasons.
And you also just let me know right before we started the recording here, but that a woman's orgasm helps act as a suction for the sperm to get on up there and do what it needs to do.
Exactly.
If that's the goal of the intercourse.
Yes.
So obviously, if you're in pain, you're probably not orgasming, right?
Probably not. No.
I mean, some people,
not that you can't, you can throw some things in there, right? Yeah. But in the grand scheme of things, it's like, I don't really want to engage in it. Our body doesn't typically want to go towards things that are painful.
Right.
It's just, there's so many issues where that can arise, like with your partner, with yourself, like individually, like what's wrong with me? Why can I not enjoy this? Especially when it's kind of just been ingrained in like, this should be a pleasurable, enjoyable activity for all.
Right.
So when she mentioned that, I was like, okay, one, I'm not the only one, because it feels very isolating when you have pain with intercourse.
Oh, yeah.
Because everyone around you is kind of talking about how great sex is, and you're over here like, sure.
Well, and I feel like pain in general can be isolating.
Yes.
Just because you can't see it.
Right. You look perfectly normal.
Right.
What do you mean you're having pain? That doesn't make any sense.
Well, and especially as women, we're constantly told that we shouldn't show like that we're in pain.
Yes. Just like sit and be.
Yeah.
And that's not okay.
Right.
So that was the first light bulb where I was like, okay, I'm not the only one. And then the second was like, if I'm not the only one, people need help with this. And like, how much better of a connection can I have with these people if I've dealt with it myself? So, and with the bowel and bladder and everything there, that's being able to help someone with that is a huge quality of life thing.
Yeah.
And so to get to have that impact where you're going from not ever being able to like jump on the trampoline with your kids to like running and biking and jumping and like running around with them. And that's impacting your relationship with your kids or your grandkids or whatever.
Yeah.
So getting to have that impact with honestly something that's not super challenging to address once you know what's going on was like, how can I not want to do this?
Exactly.
So I was sold from there on out. Like I was just like, pelvic health is where it's at, which is funny because it was the last thing I wanted to do, but here we are.
Well, I think a lot of people find that, they never meant to go into something and then they do.
I think you hear it so much.
Oh, yeah.
Yeah.
So I want to go back to, I guess, the first part of why you got into it,
Mhm.
which is pain with intercourse.
Yes.
But I think a lot of people, when they hear about pain with intercourse, their first thoughts are probably PCOS, or some sort of trauma.
Right.
And not just that it could be a muscular imbalance or some other issue going on. So how often are you dealing with patients who it is like they've had a trauma?
I mean, it varies. Like, it's one of those annoying answers of like, well, it depends.
Yeah.
Because it can really be all over the map, and what you also define trauma as. Because is this a physical trauma or is this more of an emotional trauma? Having grown up in Oklahoma in the Bible Belt, like I was raised in the church. I'm a believer.
Yeah.
And I grew up in a very like heavy purity culture. And so sex is like, you don't have sex. Yeah. But you also kind of disregard anything from like your breasts to your knees. Right. You don't think about it. You don't talk about it. You don't touch it. So then there's like this epidemic with women or girls as they're starting their cycle, not really knowing what to do or resources that they have or how to even talk about it. Yeah. What does this mean when I have my cycle? Like, is it just that I bleed and we move along? Yeah. So there's this heavy lack of education as to like this really vital, important part of our bodies. Right. And so that is often this kind of turmoil of sex is bad, sex is bad. But then if you're doing it in the sanctity of marriage and now you're married, there's this really big paradigm shift of like, now sex is great and it's enjoyable and like, you're going to have the best time. Right. And it's like, I spent a significant portion of my life saying like, it's bad, you can't do this. And now without having any knowledge of my pelvis, I'm supposed to just like know what to do. Like, this doesn't make any sense. And so as a woman, it's like, I don't even know how to connect to this area. I don't know what drives it. Like, I don't even know what it is. Right. And then if you kind of shift that perspective to the male perspective, whenever they're getting that message, their genitalia is external. You see it. You like spontaneous erections happen all the time. So there is definitely more, and play is going to be the best word that I use, but more experimentation, I should say, with a male and his genitalia than a woman. And there's not the same taboo for them to discuss. Like, boys will be boys. Right. And then men, not that women never do, but men tend to gravitate, or boys tend to gravitate towards like pornography. And then you think even like movies and stuff like that, right? Yeah. And they just get more exposure to, even if it's not necessarily medical information, just information in general, or even just seeing like, oh, like my penis could look like that, or it could look like that, or it could look like anything on the spectrum. Whereas women, it's like, you don't always know. Yeah, we don't look. Right. Because you're like dissociated from it. Exactly. A man can't necessarily, it's right there. Like, you see it. So then there's this exposure of, okay, this is what the movies tell us sex looks like. This is what websites tell us sex looks like all of this. And then those beliefs are now taken into like marriage. And then there's these assumptions because I know what my body does. Like, as a man, I know what my body does because I've experimented with this. As a woman, I don't know what my body does because I've not experimented. And now these things are supposed to intertwine. So there's this tabooness, this lack of communication, and just the way that sex works physiologically and desire and arousal is not the same between men and women. Right. I mean, I kind of use a little kitschy explanation of a man is like a Prius and a woman is like a diesel. You can jump in a Prius, you can take off. You can't jump in a diesel and take off. You got to warm it up. Or like this analogy in a microwave. Yeah. Like, if I want something fast and quick, I'm going to throw it in the microwave. Right. If I'm going to take care and I'm going to like tend to it, I'm going to put it in a crock pot. Okay. So that's kind of a nice analogy to like a woman is a crock pot and a diesel. And it's not to like minimize that a man physiologically just like reaches desire faster, but the way that the blood shunts is just a lot faster that it happens for them. And arousal and desire typically happens faster. Typically, I won't say always, because depending on people's like desires and arousals, like things can vary. Right. But overall, that is at least going to be the more common theme. Yeah. And so if we don't recognize that because we watch the movies, then, you're both aroused at the same time. You both spontaneously orgasm at the same time. Like, oh, that's how sex should be versus we're not seeing how we're getting to that point. And most women operate that way. We're more emotional beings. So intimacy for us is well before arousal and desire. And if we don't get to communicate that with our partner, then things can be an issue. And then if blood's not getting there, it's kind of a requirement, blood to shunt to those pelvic floor muscles so they can lengthen and relax. The superficial layer, which is for sexual function, is elastic. And so, I mean, it lengthens around whatever you're inserting. But if you don't have that blood, you don't have that elasticity, you don't have that lubrication, then there can be discomfort. If it's friction or if it's tightness or whatever.
Yeah.
So those functions have to all happen together.
Yeah. And it's just, we don't talk about it. So it seems like a good chunk of what you do isn't just the physical, let's walk you through these exercises and these programs and figure out what the issue really is and solve it and figure out how to solve it long term, but also let's educate you.
Education is going to be huge.
Yeah.
We have 4 pelvic floor therapists here, and I think it kind of comes with the territory of being a pelvic floor PT that you are just like very education based. But when someone's coming in and explaining things to you, and I won't say I've always kind of been like, not shoved off, but disregarded, I'll say, then when it comes to someone listening to them, they're like, wow. And then to even validate, like, this is a pretty common issue. Like, I've seen this before. We can help with this. And then to know why it's happening.
Exactly.
Versus some of the previous information for people with pain with intercourse is like, well, just relax, which that always works, right?
Yeah,
when I'm told to relax and I'm worked up, it always works.
Right. I just relax immediately.
Exactly. Like, oh, that's all I needed to hear. Yeah. Thank you.
Yeah.
Like,
I just needed someone to tell me.
Yes. Revolutionary. That was amazing.
Wild.
Or drink a glass of wine. Like, things along those lines. Yeah. And so it's like, then you think you hit your stimulus. So now if drinking a glass of wine helps, over time, my body's going to require more.
Right.
So now I'm almost like incapacitated in order to be intimate with my husband.
Right.
Like, there's a deeper issue here.
Exactly.
And physiologically, yes, but the way that our musculoskeletal system responds to our nervous system and like our mental health is so important.
Right.
Because if you have now gotten so used to this pain with certain activities where you should be like safe and all of this, but your body has now correlated that to like, this is dangerous. So we're going to guard, like we've had pain, we're going to protect ourselves. Our central nervous system is likely going into more of a fight or flight.
Right.
And this is a time of like your parasympathetic nervous system, your feel good, your relaxation, like that's really where our nervous system should be and not like preparing for what do I have to do next to protect myself.
Yeah.
And then that really starts to affect like your brain chemistry. Now, if we're going to be intimate, like my body is now preparing to get ready to fight.
Yeah.
And so you're having to retrain that whole mechanism. And so, yeah, it's not just muscular. Now it's like your partner is involved in this. And so this goes into like coordinating care and collaborating with other providers because we're physical therapists. You're sharing a lot with us and we're validating. And so you can say that that's beneficial on the mental health side, the emotional side. But when it comes to certain tools, like that's not our expertise. So when women are coming in with pelvic floor dysfunction, it's like, we're going to encourage them do you have a mental health therapist? If you don't, like, this is the type that I would encourage you to see because there's so many different specialties in that realm.
Right.
And so to address it from that side too, it's typically with any type of healthcare provider, it's typically not like I can do everything. It's I can do this. And then you also need this because we're, again, not only a whole body, but we are so many systems. And so we can address the musculoskeletal system. That's our scope. And then we are going to refer you to someone who is going to be able to address another in a very specific, individualized way.
Right. And that's why it's important to have specialists that you go see for different things.
Yes. Don't look for the one-size-fits-all specialist.
Yeah. I don't think that's never going to be good.
Someone who says I'm really good at everything is typically going to be okay, maybe. Okay.
Well, before we wrap things up,
yeah.
I think the thing that I just wanted to touch on was that if someone is going to, they can't just go to any physical therapist for pelvic health.
Yeah.
Obviously, you have half the business here is devoted to pelvic health.
Yeah.
But what are things that people should look for before choosing a pelvic health provider?
Yes. I mean, what I'm really passionate about is like, what is your care going to look like when you're there? Is this one-on-one care? And is that for the entirety of your visit?
Okay.
So that is really important. I mean, you're sharing really intimate details with someone, and they are now like holding onto your story, and they are the person who's helping you.
Right.
So not only do you want to only be with that provider, but you also want to ensure that like you're dedicating your time to them. Are they dedicating their time to you? In that this whole session is just you and I.
Okay.
So the one-on-one sessions are incredibly valuable.
Right.
Someone kind of bouncing back and forth, not super ideal, and then they can't be focused on you.
Yeah.
And like you're taking time out of your day, it should be focused on you.
Exactly.
So that would be a big part. Another one would be not only are you with the one provider, but you're with the same provider. You've shared your story, they know you, they've done your examination and your assessment. So it's not like they're having to relay this information to another person who can now like put their spin on it. Because even though the bulk of the information that we get and how we do things is pretty similar, we all have like kind of our strategies and our ways of doing things that might not be exactly aligned with each other, even though they get us all to the same point. So staying with the same person just ensures that quality of care, and then just that trajectory of like where we're going.
Yeah, and the continuity.
Yes. And then just you've trusted them. Like you've seen me, I've shared something really uncomfortable, ideally that person feels really comfortable with you. And so those are really important things. And then to make sure that this is not just like, I'm not doing things statically. I'm not laying on the table. I'm not having things done to me.
Right.
It's not just my therapist manually releasing tight muscles or whatever. Like there's a lot of education, but there's also a lot of emphasis on like, how can I be autonomous in this? Because pelvic floor dysfunction does kind of feel like it's happening to us, and like we don't know what to do to be involved. So how can I teach you to have autonomy and control over this? So like this is what I'm finding with my skills. This is how I'm going to help, but I want to be a means to an end. I want to give you the ability to get to address this on your own.
Well, I hope that you learned as much as I did from Dr. Tristen Swengle during that interview on pelvic floor health. And I hope you're as excited as I am for season 3 of Healthy Humor with Doc MB. This season, we're going to continue to have some amazing guest interviews and specialists on the show, but we're also going to be adding a few new things. Some downloadable self-graded quizzes along with guides to living your happiest and healthiest life. So don't forget to hit like, subscribe, follow, whatever you need to do to stay up to date with the latest information. Again, this season is going to be very exciting, and thank you. I hope you have a happy and healthy day.